Suchita Javeri, and I am a medical student at UTRGV School of Medicine. And I have the privilege of introducing our next speaker, Miss Valerie Rivera. So a little bit about Miss Rivera. Miss Rivera was born and raised in Edinburg, Texas. She graduated with a Bachelor in Social Work degree from the University of Texas Pan American, where she also went on to receive her Master's in Science and Social Work. Ms. Rivera began her career working in the nonprofit sector with adolescents that were at risk of dropping out of school due to social and/or economic issues. After 8 years of servicing this population, she moved on to a supervisory role for employees working in the same agency for 7 years. At that time, she was also a field instructor for interns in the social work and rehabilitation departments at UTPA and the University of Texas Rio Grande Valley. Ms. Rivera wanted to experience other social work opportunities and started teaching as an adjunct lecturer at UTRGV through the social work department. After leaving the nonprofit sector, she opted to work in a field that was foreign to her, so she became a social worker for a local hospital. It was a world filled with education and insight to a completely different population. Ms. Rivera was working with people from the community of all economic statuses facing illness that were curable or terminal. Ms. Rivera decided to work with UTRGV once again, and this time through the School of Medicine. Her reasons are highly connected to her experiences at the hospital, and although patients were her primary concern, she often worried about the physicians due to the high demand set forth. Ms. Rivera's goal is to provide students with the opportunity to release stressors that may inhibit them from receiving qualitative education due to the current and past traumas, tensions, or anxieties. Ms. Rivera's zeal in the fields of mental health is to alleviate adverse childhood experiences that continue to take a toll on one's adult life. She continues to pursue learning opportunities by enhancing their knowledge in this specialty. Ms. Rivera recently became 1 out of 5 certified eye movement desensitization and reprocessing therapists in the local area, while also holding a certification as a certified clinical trauma professional. Ms. Rivera believes that therapy empowers people to find their inner strength to deal with concerns, which leads to self-gratification, comfort, and healing. So with that, Ms. Rivera, the floor is yours. Ms. Rivera, we're having trouble hearing you.
We're still unable to hear you, Ms. Rivera. Ms. Rivera is going to log off and log back on, so we're just going to give her a couple of minutes.
Okay, can you all hear me now?
Yes, we can.
Oh my gosh. Okay, I'm not sure what happened, but let's try this again then. Thank you guys for being patient. All right, and my screen is visible to you all?
Yes.
Okay, perfect. Okay, so let me start again. So like I was saying, I'm excited to be here and I'm grateful for the opportunity to present on the impact this pandemic has had and continues to have on our mental health during this time. So while we spend this time together, we're going to learn how COVID-19 has impacted mental health. We're also going to define how COVID-19 continues to remain rampant in racial and socioeconomic disparities. We're going to discover how COVID-19 plays a role in social welfare, and we'll learn how to support those in need. Let's take a look at how COVID-19 has impacted the world. As of Wednesday, over 23 million cases have been confirmed and over 821 deaths have occurred worldwide. In the US, over 5 million cases have been confirmed and a little over 179,000 deaths have resulted. Recognizing what's typical and what's not is important. So stress is a normal psychological and physical reaction to the demands of everyday life. We need stress to help us accomplish certain tasks, and it can even boost our memory as needed. Stress is also something that alerts the flight or fight response as necessary. Reactions to difficult situations are dealt with differently by everyone, and it's normal to feel stress and worry during a crisis. But various challenges daily, such as the effects of COVID-19 pandemic, can push you beyond your ability to cope, causing dysregulation. During this time, many people have experienced feelings of helplessness, sadness, anger, irritability, and hopelessness. So other notable difficulties such as difficulty concentrating on typical tasks, changes in appetite, sleep, and exercise can impact our daily functioning. Somatic symptoms such as body aches and pains may be more prevalent due to cognitive distortions such as catastrophizing, the impact the pandemic has on an individual. So when these issues are not addressed, they tend to take a toll on a person, making it difficult to sustain adequate mental health. The CDC has been asking Americans about their mental state, and what they found is that a third have experienced symptoms of anxiety and depression due to the pandemic, specifically young adults, Black and Latino people. According to a survey involving a little over 5,000 individuals released by the CDC, results showed that over 40% reported struggling with at least one sign of declining mental health. And so in other words, people experienced anxiety 3 times more during the pandemic than during the second quarter of 2019. And 4 times as many reported experiencing depression. So what's the difference between anxiety and depression? Anxiety is the feeling of worry or unease about the anticipation of something dire happening with an uncertain outcome. Anxiety can be triggered by stress, thinking patterns such as excessive or intrusive worrying, emotional reactions, and or dysregulated bodily symptoms such as restlessness, fatigue, or agitation. Whereas depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Depression affects how we think, how we feel, and or behave. Moods are altered, causing irritability, changes in eating and sleeping habits, and if left untreated, it can lead to suicidal ideations. Illness anxiety disorder is a DSM-5 diagnosis that falls under somatic symptom and related disorders, which is previously or more commonly known as hypochondriasis. IAD entails a preoccupation with having or acquiring a serious undiagnosed medical illness. Somatic symptoms are not present, or if they are present, they're usually very mild in intensity. An individual's distress stems from the anxiety about the meaning or cause of the complaint, not from the physical complaints themselves, though. Illness preoccupation must be present for at least 6 months. So people may start to recognize that even after taking proper precautions and protecting themselves, the fear about contracting COVID may remain prevalent in their minds. So cognitive distortions. This is a psychological term that describes a pattern of faulty thinking. During such a stressful and extraordinary time, such as the coronavirus pandemic, most of us will be more vulnerable to irrational thoughts, such as catastrophizing. Worry and uncertainty will evoke the fear center known as the amygdala to react. That means compulsively checking temperatures, Googling symptoms. We may be compelled to stockpile supplies such as food, basic household necessities such as toilet paper and Clorox wipes, or taking money out of the bank. Thoughts can also lead us to believe there will be an apocalypse where people will break into our homes, such as survival of the fittest approach. So this creates scenarios in our minds, such as fighting back and inflicting harm so that we can protect ourselves. People ages 18 to 29 years old are most affected by mental health during the pandemic. Isolation and loneliness from quarantine is a huge result from it. All humans, but especially young people, are hardwired for connection. So they depend on this to build their identity. Connection is a fundamental human need for well-being and survival. Dr. Julian Holt-Lundstad, a professor of psychology and neuroscience at Brigham Young University, found that a lack of strong social connection can raise one's health risk as much as smoking 15 cigarettes a day or misusing or abusing alcohol. That's twice as much as obesity's impact would be. So this indicates that social isolation and loneliness considerably increases risk for untimely mortality. Other factors that play a role in mental health are chronic stress and chronic worrying about their health and safety. And financial stress is another known predictor of student mental health, which has been considerably affected by the pandemic. Reports show that students' financial situations have changed, as well as their living situations as a result of the pandemic. So if we take a look at the different categories, we'll see that there's a comparison of fall 2019 and March through May of 2020. What this chart points to is that symptoms of mental health conditions remain elevated in college student populations, both before and after the start of the pandemic. Compared to fall 2019, we see that depression increased a little over 5%. So during the pandemic, a higher proportion of students report that their mental health negatively impacted their academic performance. We can also see that substance use and binge drinking decreased in spring 2020, which can be attributed to social isolation and mandated quarantine. So as we know, universities play a crucial role in supporting college students by accommodating not only their health, but their education and safety needs. During the pandemic, the courses of action implemented by universities have an impact on students' mental health and well-being. 2 college campuses have taken different approaches to ensure safety. So according to Professor Sarah Townsend at Penn State, she says that the campus has implemented inadequate safety procedures that has students worried for their health, while the University of Illinois is seen as a campus to follow protocols that align with scientific data to support safety. Students that feel anxious about the decisions made by universities to return to campus should take an active role in advocating and voicing concerns, informing themselves of all opportunities to remain safe and healthy allows for a sense of power and control, which aids in the reduction of anxiety. Professor at the UC Berkeley School of Social Welfare, Tina Sachs, said, "People often talk about race as a risk factor for illnesses, including COVID. It is not race that is a risk factor, it is racism that is a risk factor." And as I was doing research for this presentation, I found that statement to really coincide with the numbers that are being presented right in front of us. So the color of coronavirus, if we take a look at these statistics, we see that Black Americans continue to experience the highest actual COVID-19 mortality rates nationwide. That's more than twice as high as the rate for whites and Asians, who have the lowest actual rates. So COVID-19 is affecting Black, Indigenous, Latinx, and other people of color the most. But when we look at these numbers, we see that Black people are dying at 2.4 times the rate of white people nationwide. We've lost at least 35 plus Black lives to COVID-19 to date. And Black people account for 22% of COVID-19 deaths where race is known. Black Americans continue to experience the highest actual COVID-19 mortality rates nationwide. I'll say that again, because if we kind of compare it to other populations, we see that if Black Americans had died of COVID-19 at the same actual rate as white Americans, about 19,500 Black Americans would still be alive. And I just kind of want to let that number sit for a minute, because it's important that we are able to recognize the impact that this pandemic has had on different populations. Now, if we compare other populations, we see that 8,400 Latinos would still be alive in comparison to white Americans, 600 Indigenous, and 70 Pacific Islander Americans would still be alive. So let's ask the question why. Diseases like COVID-19 spread more rapidly among vulnerable populations. African Americans have higher rates of underlying conditions, including diabetes, heart disease, lung disease, that are linked to more severe cases of COVID-19. Initial data suggests that predominantly Black counties have 3 times the rate of COVID-19 infections and 6 times the rate of death than predominantly white counties. Higher rates of conditions such as heart disease, asthma, cancer, obesity, diabetes, and hypertension in communities of color increase the risk for COVID-19, particularly and overall decreases the life expectancy for Black men by more than 4 years compared to whites. It's also notable to understand that they have less access to quality health care. So other risk factors that play a role in the rapid spread of coronavirus is the inability to work from home, workplace exposures, living situations that include mass settings such as nursing homes, group homes, treatment centers, and even correctional facilities, having to use public transportation to get to and from work. When we look at the healthcare system for the Black communities, there is delayed or inferior medical care that can be attributed to lack of health insurance or mistrusting health providers. High risks from our systems of housing, labor force, healthcare, and policy responses are what is termed as systemic racism. I came across this and I thought it was important to share as part of understanding the lack of healthcare in populations and vulnerable populations. So the expansion of Medicaid would provide more low-income adults with access to healthcare services, which would enhance health outcomes. This would particularly benefit people from communities of color because many work in low-wage jobs that do not offer health benefits. So to date, there are 12 states that have not adopted the Medicaid expansion program, leaving minority populations without access to basic care. And as you can take a look here, all of the blue are the states that have not, expanded this program. So what do we do, right? Self-care is good. Self-care is something that we've been hearing more often, and self-care is something that provides mental and physical well-being that can help with regulation. But consistency is key. And although we may not be able to resume our previous normal, we can definitely shift and formulate a new normal during this time. So creating a routine that will allow you to feel in control is important. You know, getting enough sleep, participating in regular physical activities, eating healthy. Avoiding tobacco, alcohol, and drug use is important, right? Because when we use these things, it's usually a sense of avoidance, and this reduces our coping skills. We also want to take into account that we need some time to recenter ourselves. So taking a few minutes to quiet our minds down is important. This helps reduce anxiety. Limiting exposure to news media, finding adequate outlets, news outlets that provide reliable sources such as the CDC and the WHO is important. And then definitely focusing on our thoughts. So choosing to focus on positive thinking instead of dwelling on how bad we feel is important, right? Finding these alternative thinking patterns and connecting specifically with people that are a part of our support system. So connecting with them virtually or by even practicing physical distancing. So in order to improve mental health, we must first identify at-risk populations in our communities and provide resources and access to care. The American College Health Association provides a breakdown of vulnerable populations and offers suggestions and recommendations for meeting the needs of each group. Education about how this pandemic has affected groups such as African Americans, Asian Americans, first generation low income, LGBT plus and undocumented students, as well as students with disabilities, should be disseminated for awareness purposes. Conscious understanding permits cultural competence and sensitivity. As a student, we need to be able to identify peer support groups, mentors, allies to connect with to help support your needs. Consult with campus stakeholders, deans, faculty, and/or your staff about implementing new services or programs that are lacking to meet yours or other needs. Campuses should be providing ongoing trainings or workshops about inclusive care and using inclusive language, by attending these, it's going to help students feel connected to other groups and understand other needs that groups have. Campuses should ensure that services such as counseling, student rights and responsibilities, and student accommodation services are encouraged and available. So, during this time, we understand that the pandemic has changed the world and our normal. When the pandemic ends, we will re-enter the world differently. The overwhelming stressors of the pandemic will subside, but people will still be left with residual feelings from it. So it's important to find healthy and effective coping skills, even if that means seeking therapy or talking to a close support system to process the effects of this pandemic is important. These are all the wonderful resources that I used to utilize the data for this presentation. And during this time, I want to applaud your efforts to be a part of a movement that will make changes for populations that require your voice. I'm grateful for the opportunity to have been a part of this with you, and I thank you.
Thank you so much for that amazing presentation, Ms. Rivera. So now we have a couple of questions from our attendees. The first question we have is, post-pandemic, do you think healthcare providers should have a extensive knowledge on mental health, since this will be a big consequence in the society?
Absolutely. You know, I think that even pre-pandemic it's one of those things where anybody that is a part of a healthcare system should have a good understanding of what mental health entails, you know. And now that we are entering, like I said, a really different world during this time, it's important that we all have a sense of understanding what different struggles people have gone through during this time, so that we can be readily available to not necessarily help and intervene in a way that is going to put a lot of responsibility on an individual, but to just be able to direct and guide them to the people that can provide, you know, some help. So, you know, working with the medical school students right now, the stigma around mental health is one of those things that we have to break down. And the reason for that is not only for doctors that are going into the field, right, but for themselves, so that they also understand what they're going through.
Thank you for that. We have another question. With the sudden switch to telehealth, how does access to mental health services, how have they changed?
You know, hopefully anybody that is a part of the mental health service has already made the changes and made adjustments to providing online therapy services. I know that the university, UTRGV, definitely made that switch right away, and other people around the world have also started to do that to make sure that mental health is still a part of people's lives as they need it. So there's no indication that the online therapeutic service is any different from in-person services, right? Any therapist has learned to adjust very quickly, and the outcomes can still remain as well as in-person services.
Our next question is, how has lowered physician / in-person access impacted people dependent on mental health services?
Okay, I'm sorry, can you repeat that question again?
Sorry, yes. How has lowered physician or in-person contact with a provider impacted people who depend on mental health services?
I'm not sure that I quite understand that question, so I'm gonna answer it the best that I can. Like I said, anybody that is in a mental health field or even just in the medical field, I think everyone has made the adjustments as necessary, right, to provide adequate health care or mental health care online. What I know also is that doctors, you know, hospitals are taking proper precautions to have people go into centers, into hospitals, and make sure that everybody's being as taken care of as possible.
Our next question is asking, have you seen an increase or decrease in the volume of patients requesting your services since COVID-19 started?
Okay, that's a good question. I think that in the beginning, maybe there was some hesitation, you know, from some people that were used to seeing me in person or just any other therapist in person, because this is foreign, you know, not everybody was used to online, so this was all new. Now, you know, that we've had a few months to adjust to this new world, it's a little bit easier. But what I will say is that people went back to their home, to their homes. And if that included outside of Texas, then it was difficult for me to provide any type of therapeutic services. So I had to make sure that I was referring to, the state that they were in, or providing them with resources so that they can continue to take care of their mental well-being.
Our next question is asking if there are any limitations on the services you can provide over telemedicine versus in person.
I haven't come across that. I think that any type of therapeutic modality that I use, I have adjusted. In my introduction, it says that I just recently became certified in EMDR. And for most people, that's what I would do in person, right? There's certain things that I use for that. But coming online, there's programs that I could use to use bilateral stimulation. And so again, it's really just a work in progress, and I haven't held back from using any type of therapy modality.
And I believe we have time for one more question. What suggestions do you have for those professionals who are not trained specifically in mental health in assessing and intervening with patients who are experiencing COVID-related mental health challenges?
That's a difficult one, right? Because one has to be willing to educate themselves in different areas that are foreign to them. I think that if we don't educate ourselves, then there's lack of awareness. And if we are unable to recognize what one is experiencing, then it's going to be hard for that for that healthcare provider to provide adequate services, right? So in my line of work, we think of always making sure that we're able to roll out any type of health, whether that's physical or somatic or anything like that. So sometimes when there's symptoms happening, my recommendation and my referral source is always going to be, let's go get you a physical exam. Let's roll out any type of medical situation before I give you a mental health diagnosis. And so we know that usually those go hand in hand. It's what came first. Was it the physical illness that caused the mental health diagnosis, or is it the mental health diagnosis that's causing physical illnesses, right? That's how we know about somatic symptoms and things like that. So I think it's just important that in this healthcare field that we all just really become knowledgeable in both areas, or in all areas, really.
So thank you for all of your responses. One of our attendees actually did ask about the suicide prevention resources. So if you would just post those resources again in the chat, that would be really helpful.
Absolutely. Let me do that right now.
So that's all the time we have right now for this session. But if your question wasn't answered, we're also going to have a large Q&A with all of our panelists next, and you'll be able to re-ask your questions there. And at this time, I'd just like to invite all of our panelists back so that we can start our large group panel at 4:15. So maybe one or two more minutes for a break, and then we'll continue.